welcome to everyone. I know we've got some guests, but let me go ahead and get the agenda going, and then we'll start in with our work here. So, first, can I get a motion to approve the minutes from our June 2nd meeting?
So moved.
Second, Jason.
All those in favor of accepting the minutes as presented in your board materials indicate by saying aye.
Aye.
Those opposed, same sign. Okay, minutes are accepted and approved. All right, board vacancies. This is a great topic. So, Christina, I'm going to turn it over to you to manage this portion of it. Then we'll take. I'll let you take it from here.
Yeah, so right now we do still have one board vacancy. It is for our mental health practitioner. The city clerk normally notifies me whenever we receive new applications, and I have not had any notifications within the last 2 months. So we have not received any additional ones, and so no one currently, to my knowledge, fits that mental health practitioner little niche that we need. So if anyone has someone out there that they would like to petition, I do know that Meg shared that on social media and promoted it at one point back in June. We can ask, I know that there's some, she of course does a Mental Health Monday on our Facebook page. We can ask for her to promote it again. And I can push it out again at our next mental health task force meeting that we have and see if we'll get any takers. But I don't know if anyone here also has someone that they can strong arm, but
nobody from the comprehensive mental health. Are they now Buell or?
Yeah, Burrell or Burrell
Burrell.
or.
But nobody in their leadership team was interested.
No one has submitted an application.
I reached out to a couple people, one of whom works with a regional pregnancy crisis line, and I never heard back from either of them. They're busy folks, but most of us non-retired people are, and it's hard to find somebody. So I would encourage you to reach out to anybody that you know that works in that field. Their input is awfully important.
What credential do they need?
So they need to, be a mental health practitioner. However, we would like to define that. That is not specifically defined in the ordinance. They have to either have their primary place of work as a mental health practitioner be here in Independence, or they need to be a resident of Independence, one of those two.
Okay.
Well, any help in identifying somebody else would be great. So we'll just have to keep beating the bushes for that. So, anything else on that, Christina, you want to bring us up to speed on?
No, I just want you guys to be aware we do still have that one opening. So, you know, we're fortunate enough to have been able to fill the 2 other slots we had open. So we're quite pleased with that. But we are still at 9 instead of 10 members. So we just need to work at that.
Well, we're better than we have been for a while, so we'll take what we can get here. Next item on the agenda, selection of chair for the advisory board. I talked with Christina about this a bit, that I've enjoyed serving this capacity, but I felt a little bit underqualified, not necessarily to run the meetings, but just my expertise is not necessarily in health. But I am a community member that's engaged. So we thought it would be advisable for us to make it available, the chair, available to someone who might be interested in serving this capacity. And so with that being said, Christina, anything else on that you want to add?
No, the city ordinance only just says that it must be an Independence resident. You know, we've loved you as filling in as vice chair, but if you know, we need the group as a whole to make that decision about what they want going forward.
Well, I would move that I would nominate Dr. Ruddy to as chair. He's done an excellent job. Don't need upsetting the apple cart.
I second that motion if it needs a second.
This is what I'm feeling here is no good deed goes unpunished. Is that
Absolutely
what I'm to take here?
I would move that nominations close and the election be done by acclamation.
Do you need a vote on that, Christina? It's no bother to do the chair. I just thought we should make it available.
I mean, we can open it up if anybody has, any feelings otherwise. Now is the time to speak. Otherwise, we can call Dr. Ruddy chair. Do you want to have a vice chair? Should there be a time when you are unavailable?
There should be. I do.
Oh,
I think
that sounds like somebody's about ready to be punished, but okay.
I would nominate Dr. Morris as vice chair.
I probably deserve that, so for deeds not done and not known, so.
So Christina, we just do, is that by acclamation, or do you want to take a roll call? Or I don't know that we're going to have a bunch of people rushing in to take the.
I was going to say, we can make it official and just say, there are motions on the floor and we can take them both together for Dr. Ruddy as chair and Dr. Morris as vice chair. Everybody who approves.
I'll take that motion as presented, and all those in favor indicate by saying aye.
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 Those opposed, same sign.
Negative.
Okay. Hey, Dr. Morris, thank you for taking one for the team here. So, with that,
Mr. Chairman, if I might have missed a meeting, and I apologize, but the newly appointed members, if they've not introduced themselves, might that be appropriate?
I
sometimes?
skipped over that. I think that's very appropriate. I appreciate that. So I think it's a good time. So Christina, you want to work through our numbers here?
Yeah. So Dr. Legler, I don't believe was able to join us, but Dr. Stuckman, I don't know if you want to.
Sure.
Go ahead.
Yeah. Dave Suchman. I am a general dentist in Independence. I practice off 39th Street since 2001. I took over the practice with my father, Roger Suchman, who started practicing in Independence in 1972. His first office was off of Nolan Road. Practiced with Hendrik Knudsen until 1975, and then he worked in an office building off 23rd Street near the MCI Hospital. And then in 1979, he built the office where we're at now, which is off of 39th Street there. And my dad retired about 5 years ago, and I have a partner, Mac Darnall, who's been with me since 2008, and he and I are equal partners of the practice and equal partners of the building there. And then we just brought in a new associate this month, actually. So there's 3 of us in the practice. So I'm happy to be here, and I appreciate Dr. Morris for inviting me, and excited to help out. So
welcome, and thank you for your service.
Sure.
Okay. Can we get an update on COVID-19? I know we've seen an increase here, but it might be helpful to get our most recent data.
Dr. Morris, I don't know if you want to share. I mean, I can share from the health department's
Yeah,
side
I'd like
that
to
we have a
know.
lot.
I'd like to know what's going on at the city level. I've had a little trouble with the city's website trying to sort out those numbers. We've been in kind of a steady increase in Eastern Jackson County and the metro, the 6 counties in the metro area for the last 3 months. It actually has fallen a little bit in the last 10 days or so. I generally look at hospitalizations because numbers mean nothing. I took the family to Disney World and my wife and I both got COVID, and we didn't count because we did tests and we picked it up in Florida, and probably 3 times as many people have COVID as wind up on the official roll. So personally, I look at hospitalizations. Hospitalizations about 10 days ago were 101 per day. And I think that's an important number to remember, that we're looking at the number of people per day that get put in the hospital, not the number of people that are in the hospital. It fell to 78 as of this week. So it is down just a little bit. Eastern Jackson County is responsible for 8 or 10 of those, it seems. At least that's what the Mid-America Regional Council site is showing. So it's not as bad as it has been, but it's creeping up. And unfortunately, the current variant and probably the next one in line are pretty resistant to the vaccine. So there's a lot of talk about when the next vaccine is going to come, and it's basically turning into the flu, where we're trying to pick the strain that's coming. The problem is it changes quicker than the flu vaccine, so that's really challenging to do. So, but there's a lot of research being done. A lot of people still working on it. So I'm interested to know what the independence numbers look like.
So independence, our numbers are, I mean, nowhere near as bad as we were seeing back in December. However, we're still in the 40 something a day of cases being reported and coming in. And as you were stating, we know that the vast majority of people are taking those at-home tests. They're never reporting them. But the good news is that means they're also not getting so sick that they're needing to go to a doctor. So when talking this last week with the regional group, I think Independence was the only one who hadn't actually seen a decrease in the last week. So we were kind of sad to be left out, but yeah, we're seeing that steady increase. And hopefully we'll have some relief in sight soon. Our understanding is the same as what was being reported by Mark, that the hospitals has definitely seen that little bit of an increase, but not at such a rate that they can't handle it right now. So, and we are, seeing all of the other lovely diseases coming in too. So it's just great. Though, knock on wood, not monkeypox yet. So we are waiting for our turn.
Didn't the area have a case of monkeypox?
Kansas City has actually had several. So we know it's here. And we've had some possible cases, but the tests have always come back negative so far.
Okay.
Or those who have been exposed in our area have been able to get through their exposure without becoming positive. So,
and that's such a different disease because it's a direct contact, skin to skin,
yes.
not a respiratory. So you're not going to get it at the movie theater, or kind of a disease. So.
Christina, related, I know we are headed into flu season, and while you're trying to manage this, what are the plans to increase, or at least plan for, getting as many folks flu vaccine as we can?
So I guess that kind of leads into, I was asked to give a little bit of an update on staffing and office space and everything else for our staff also. So we are trying to build up our staff. It seems like sometimes, every single time we take a step forward, someone else decides to be stolen away by a different department. So we haven't made a ton of progress. We had a nurse, a part-time nurse, and she left us, and we got another part-time nurse. We are still hoping that we are going to be able to do flu vaccine. And we still have that plan in place, and we are working to make sure that it gets here and that we're able to try to work to get it out to those who are most vulnerable and who need that access. Can I tell you 100% it's going to happen? No. But that is absolutely what we're aiming for, and we're going to try to we're still relying on volunteers heavily to do COVID vaccinations and homebounds and different whether it's vaccination clinics at the school or with Community Services League, we are still doing our best to be out there. We have a standing clinic that's open at City Hall every Friday. We are out doing homebounds every Wednesday. The need is still there, and we recognize that. And we're also trying to make sure that we can shift to do the flu vaccine also. Yeah, we're trying. That's the best I can say. We actually have
So-
3 positions that close on tomorrow. Yeah.
No, go ahead. I'll let you finish.
Yeah, one of them's a public health nurse, another public health nurse that we desperately need. A public health specialist to work on some of our other grants for health disparities. And then an admin. We actually need more admin help. Our admin is drowning trying to keep up with all of the billing and reporting. And so hopefully we'll be able to hire, it looks like we have some good candidates. We'll be able to hire someone to help. And then we've started moving some people around. We're transitioning right now from downstairs on the bottom floor. Some of our staff are going to stay down there, some of our food inspectors, and the rest have already started to move up to the second floor, which is that main lobby area right off the Circle Drive in City Hall, going into that space. So we've been able to move some of them into their offices, and we've had 2 new people start this week. A new planner, because our planner left us for greener pastures, and a new grant-funded epidemiologist who's in there to help with the caseload, because we just have so many, and our epi was drowning. So we've got them started this week, and hopefully we'll have a few more starting by the end of the month.
Thank you. So you're suffering the same staffing issues that everyone seems to be suffering from. Is there maybe a regional approach with like Jackson County, other health departments to address this, or cooperative kinds of arrangements?
I wish there was, one of the things Jackson County steals from us all the time. They always have, and they're in that wonderful position that they're a local health department, but they're also actually, the hospital. And hospitals nurses typically are able to pay, have higher pay than a public health nurse. So we just can't compete always with that. We are going through the process, the city as a whole, to look at our pay plan and our structure. Because we have grant money, we've been able to throw some of that to help increase some of, those salaries, but we're just never going to be able to pay the same money that hospitals can pay right now to lure those people away.
Okay. Well, thanks for that update. Next is a discussion on mental health co-responder program.
So this is exciting. Last week, one of our firefighters, the paramedic John Burrell, went out for the first time with a social worker. They are going out on Tuesdays and Wednesdays from 10 a.m. to 8 p.m. They are responding to crisis calls that are coming in through 911 for, whether it's homeless, whether it's mental health issues, and there's no weapon involved. They are starting to respond to those cases. This is we're still in what we would consider the pilot program. So they're going to do that for a couple of months and then reassess with what we need, what we should change going forward. It's taken a lot. I mean, many of you guys know, you've sat in on those meetings. It's taken a lot to get here, and to pull all of the departments together to be ready to do this. Changes with, working closely with dispatch to make sure that they know how to route this. We ran into a big issue with getting a social worker that was available, because they're in really high demand right now. So we ended up having to contract for a social worker to get it done. But they are out there, they're running the calls. My understanding is that they were very, very busy for these last 2 rounds. But they're pretty excited. So I'm excited. I really, really hope that this goes well, and the city really hopes to be able to expand this going forward. But a lot of that's going to depend on staffing availability. I know as Burrell goes ahead and ramps up their crisis center and gets that going, that hopefully we'll be able to expand this out. But John with fire, he really worked to get agreements in with all across the region to make sure that if they pick up somebody who needs immediate access, that they could get them in and get them there. So, I mean, hats off
Can
to
you talk
him.
to me how they make that assessment?
Well, probably some of that is above my pay grade with a social worker, but are you talking about, I guess, the assessment of whether this person needs to go to a crisis center or whether they?
Yeah. How's that process
Well,
work?
I mean, I think that really depends on that social worker. She's trained, and her emphasis is in that mental health social working. So she has that background. As a paramedic, I mean, he's had some training, but I know not exactly in the same bent. And so a lot of it's going to be, if a call out and trying to feel the scene and figure out what's best and encourage the person to do that. You know, they want as much of this to be, of course, voluntary and for the person to want help. So making sure that they have those resources and that they're then able to follow up going forward with those people to make sure that they're getting the help they need, and that we find a more permanent solution. And it's not because they know that they have a lot of phone calls from people repeatedly who have these issues, and they want to make sure that they get that help and they find it, and have a better life as a whole for independence.
So what's the data collection? So when there's an assessment of the program or that shows a need for expansion or whatever, what are you collecting that allows us to make sure this is a program that's funded going forward?
I don't know exactly what John's collecting. I know that he has a huge list of things that he's collecting, and in fact has worked really, really hard to make sure that the collection is done, because that was one of the things I was questioning him about, is making sure that there are agreements in place with those crisis centers that they go to ensure that follow-up and that we can draw the data about how well it's done. He assures me that he's made those contacts, that he has that agreement in place. It's not going to be perfect, and a lot of it is going to have to be retrofitted, because we've never tried to gather this sort of data before. And pulling it from dispatch logs has shown that, of course, different dispatchers, use keywords differently and log calls differently. So trying to figure out how to make sure that everyone is trained to log it all exactly the same way, so that when we pull a data set, that we get an accurate report. That's one of the many things John's working on, and I know it's not going to be perfect. And I've told him, and everybody else has told him, you know what, we're going to try, and we're going to get all the best data we possibly can. And if we have to modify it in a month or in 2 months, we'll keep modifying. I know he also worked, he's already talked to Health Forward Foundation about getting funding going forward after the pilot is done. And they've encouraged him with certain pieces of data that they would like to see in order to fund it going forward. So I know he knows that. I'm sorry, I don't. But I know he seems to know what he's doing. So thank God one of us does.
I put you on the spot, so
It's fine.
thank you.
When he
And
gets
the
settled, we'll.
Cahoots,
Oh, sorry, Dr. Morse. Go ahead,
I
sir.
was just going to say the Cahoots program in Oregon and the STAR program in Denver are really very forthcoming with the data that they collect. And I suspect he's probably trying to be similar to that as far as the data that's helpful to government to decide whether that's helpful and to present to the medical community as far as how we can keep these people out of the ER and get them quicker, better help than what they've been able to get in the past.
He was fortunate enough. He and one of our dispatchers actually went out to Denver and visited with the STAR team and spent a couple of days out there in order to see exactly how they ran it, what they ran into, what the problems were, and how they gathered what they did. So I know he's continuing to be in contact with them, and they are phenomenal on providing him all of that leadership that he needs. So
Perfect.
When he gets settled, might he be able to provide us, whatever reports and sort of an assessment? I mean, he's getting started, so I don't want to add to his
Yeah.
list or anything. But
no,
when
I know. I worry
appropriate.
about that too. I told him I want him to stop by City Hall and tell me all about it, but I also understand that he's probably really overwhelmed at this moment, and I should probably give him a minute. I will definitely ask him to. I know that the council has also asked him as soon as this pilot's done to expect to be called back for a study session. So he knows that people are very, very interested in how this goes.
Exciting to get this off the ground. It's a much needed service, and that's good for us. It's good for Independence. So, anything else that we need to cover, Christina? I think we've covered the agenda for tonight. Unless anybody has
No.
a pressing item they want to ask. If not, then I'll call for adjournment and take a motion to do so.
Adjourn.
I second.
All those in favor of adjourning indicate by saying aye.
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 Hey, folks, thanks for your time. And Christina, next meeting is scheduled for when? Sorry, keep putting you
No,
on
it's
the
okay.
spot.
You asked me the hard questions. Hold on. So it will be October, and it looks like October 6th.
Okay, great. Thank you.
Thank you.
Hey,
Have a good
thanks,
night, you guys.
everybody.
Thanks. Good night, everybody.
Have a good night.
Bye.